So gambling is a public health issue because, like so many other activities, say alcohol, for example, lots of people enjoy gambling and do so because it's fun and get entertainment value out of it. But for some people develop really severe problems from their gambling behaviour, and the consequences of that can be exceptionally severe in some instances, but can really affect both the individual, their communities and society more generally. Thinking about health in particular, there are a whole spectrum of issues that are related to gambling problems. So it can cause stress and anxiety, feelings of shame, stigma. It can cause physical health problems because people don't take care of themselves and have poorer health as a consequence of that. In the most severe instances, we see people who have problems with their gambling behaviour thinking about taking their own life, and actually it does indeed, in some circumstances, lead to loss of life. I think the research that we're doing now is vitally important because we are looking at the cohort of young people who are growing up in a completely different gambling environment, a completely different digital environment where people's lives are increasingly conducted over smartphones, they have social media connectivity, but the industry are also using all of these things to market their products. And I think it's really timely to actually really look at this in depth and try and figure out what the processes are that are happening here and also what the impact on behaviour is. We really need to understand the types of behaviours people engage in, but really why and what's motivating them and what's the context of their behaviours, what's shaping what they do and why they do it. And it's really important to know this because you need to have that insight to be able to plan effective interventions, for example, to try and mitigate harm. If you don't have that insight, you could find yourself spending an awful lot of time and energy trying a particular intervention that just proves not to be effective because you haven't really got to the crux of the problem. And that's why it's so important to have research underpin policy.